I developed gynecomastia, I would probably say around 18 is when I first noticed it, and probably took about 6 years until I got it diagnosed and confirmed and sought out surgery. The effects of gynecomastia were, one, I didn't like wearing tight fitting shirts. Being in the fitness industry, a dry fit shirt is kind of common, and I didn't like wearing those because the way my nipples looked. The triggers definitely, from the start of when I first got it, and being an athlete, working out every day, trying to use fitness to beat it, not really understanding what it was, to moving on to more extreme things of buying the pills, trying different supplements, finally I got children in my life, and as they get older, and I have a daughter who's rubbing on my nipple one day, asking me what it was because it's kind of sticking out funny. That definitely wears on your mind and helps your self-confidence drop more. You got your little kid touching your chest, asking you what it is on your nipple, and that was a struggle. As far as the surgery, I wish I would have probably consulted and maybe found out what it was and think about surgery sooner, but like most people, we try to maybe avoid going under the knife. So I tried all these unpractical methods to try to get rid of this that were, didn't work. The pills are a gimmick. I tried all the working out you could do, but it just doesn't get rid of that problem area. So the recovery process was a lot faster than I thought. I thought I was gonna have this 3 to 6 month process. It ended up being, I think, 2 weeks of downtime before I could do anything. And after 2 weeks, I was back in the gym, not fully functional, but I was operational, which was a plus. Since the surgery, the ability to take off my shirt, whether it is just working out or if it's with my kids, going to the beach or the pool, I don't have to second guess, or there's not that little voice in the back of my head asking, saying, why are you taking off your shirt? I'm totally confident, and I can focus on my family, which is most important.